Good morning, everyone. What a great crowd. Welcome to Sauk Prairie High School. My name is Marianne Marks, and I'm proud to serve as a school board member here in the Sauk Prairie School District.
Hello, good morning, and I'm Amanda Boatwright, a social worker for our elementary students. We are here today to celebrate the awarding of a school-based mental health grant to the Sauk Prairie School District, and gather to acknowledge our collective responsibility to effectively address the mental wellness of our students, our families, and our community.
In addition to my role on the school board, I spent over 20 years leading community education programs. Prior to that, I'm a certified life coach, mental health coach, and coach trainer. I've confronted the pain, the isolation, and the confusion that inevitably arises when the systems to support our neighbors break down or don't exist. I've also witnessed firsthand the power of collaboration to address community needs.
Thank you and good morning. Several of you asked me when we first got here, yes, it is spring break. We typically have a very full parking lot and a lot more students in these halls. But when this is the time that worked for Congressman Pocan, we took advantage of the fact that we have a really quiet lobby. It'd be really hard to use this space on a typical Tuesday morning. Before I get going, I do want to thank again all of you for being here. Thank our state senator, our state representative, Dave Considine, State Senator Diane Hesselbein. I'm missing where you are, Dave. Oh, right next to Tyler. Sorry, I was looking at you instead. And all of you who are gathered here today to acknowledge this grant and this opportunity for us to more effectively address the mental health of our community. I also want to make sure before I start into my prepared comments to once again thank the two lead writers on the grant, John Woloshin and Dr. Noel Sapiro. So thank you both for your leadership in this. We know that mental illness strikes young people and that it can have devastating effects on both children and families. We know that mental illness treatment relies on a system that is widely acknowledged as broken. And we know that a startling number of people in our communities do not have access to treatments known to be effective, or they receive inadequate treatment. But we also know that there are so many dedicated individuals and organizations that aim to provide these treatments to our neighbors, but that too often this challenging work is done by healthcare, human services, school district, and law enforcement teams without adequate coordination. Addressing this reality is the core mission of this school-based mental health project. Our goal is that the Sauk Prairie School District, in collaboration with our community partners, will move from a model of separate services to a model of interagency connection and collaboration, with the school as the ideal hub for service delivery. Let me share a specific piece of evidence that we believe can prove that this works. Last summer, our school district invested in a new program designed to help individuals get access to mental health care. If a student or a family member is looking for help with mental health or substance abuse, this service can help them more quickly find options to match their individual needs. It is free, it is confidential, it's provided to students, staff, and their families by the Sauk Prairie School District. It's available 24 hours a day and in any language. It's been 6 months since we launched this. And it's good to know that so many individuals have been matched with appointments for care. But what most surprised me when reviewing the anonymous reports is that 18% of those reaching out for help are not our students. They're parents, they're grandparents, they're other community members seeking help with anxiety, with marital counseling, and other needs. Schools can be a hub for service delivery, even for those who only visit the school to drop off a child or to attend a sporting event. This new program we launched last summer is just one step toward more effectively meeting the mental health needs of our community. But this grant today from the U.S. Department of Education will make us go much further, and I'm proud to be asked to teach about it. This school-based mental health grant provided funds to 103 state education agencies and school districts across the country as part of the Bipartisan Safer Communities Act. The Sauk Prairie School District was awarded $4,660,083 over a 5-year period. A 25% match is required, and this match includes new investments aligned with this grant made by our collaborative partners. As our district wrote this grant proposal, we relied heavily on the guidance from the National Associations of School Counselors, School Social Workers, School Administrators, and School Resource Officers, as outlined in their document, Framework for Safe and Successful Schools, that was originally released in 2013. Let me read part of this important text. At all levels, we must remove the barriers between education and health service agencies. Schools serve as the ideal hub for service delivery. However, schools must be adequately staffed with school counselors, school psychologists, school social workers, and school nurses who can provide the proper services in the school setting, connect students and families to the appropriate services in the community, and work collaboratively with external agencies to ensure streamlined service delivery and avoid redundancy. That text outlines our overall goal, that the Sauk Prairie School District, in collaboration with our community partners, will move from this model of separate services to a model of interagency connection and collaboration, with the school as the ideal hub for this service delivery. So what will this coordination look like? This grant funding will allow us to hire a licensed clinical therapist, helping us connect students to behavioral health care right when it is needed. We will do this with our partners at Sauk Prairie Healthcare. We will be able to hire cross-agency coordinators and 2 additional school social workers. This team will coordinate with our partners at County Human Services, local law enforcement, and other support teams to help get help where it is needed more quickly and eliminate unintentional redundancies of care. This grant will also empower us to further train existing staff and focus resources to make sure that those who are taking care of our students are also taking care of their own mental health. We're not the only community in Wisconsin that's facing these challenges. I believe that the U.S. Department of Education invested in this grant proposal because it saw potential for us creating a replicable model that can help school districts and agencies charged with supporting families all across Wisconsin. What an exciting challenge to get to reimagine service delivery with so many dedicated partners. This work of mental health is tough work. It's heavy work, and it can be emotionally exhausting. Wendell Berry, an agrarian essayist, wrote, "Be joyful, though you have considered all the facts." I am joyful today because we get to do this tough, heavy, and exhausting work together, which is literally the whole point of this grant. To formally kick off that important work, I'm proud to welcome Linda Hall, Director of the Wisconsin Office of Children's Mental Health, and then another longtime friend of our school district, our Congressman Mark Pocan. Linda?
In his 2023-25 biennial budget message last month, the governor talked about the CDC's recently released Youth Risk Behavior Survey report, which includes alarming statistics about the state of student mental health. In 2021, more than 40% of high school students felt so sad or hopeless nearly every day for at least 2 weeks in a row that they stopped doing their usual activities. 1 in 10 students attempted suicide, and 1 in 5 students seriously considered attempting suicide. Just stop and think about that. Those of you in this room, you know, just think of 5 kids you know and what that statistic means. And the statistics are especially bleak for teen girls and LGBTQ youth. Nearly 60% of teen girls felt persistently sad or hopeless, double the rate for teen boys, and nearly a third of teen girls seriously considered attempting suicide. About 40% of LGBTQ students experience persistent feelings of sadness or hopelessness, and more than 20% of the LGBTQ students attempted suicide. As the governor stressed, no one can read these statistics and say with a straight face that we're already doing enough. That's why he declared 2023 the Year of Mental Health and introduced in his 2023-25 biennial budget a budget that really makes mental health a top priority for all Wisconsinites, but especially for our kids. We can start by addressing the statistics and make sure every kid has access to school-based mental health services through Governor Evers' Get Kids Ahead initiative. He's proposing more than $270 million to make the Get Kids Ahead program a permanent state program and ensure every kid has access to mental health services. He's meeting Wisconsin's student mental health crisis head-on by investing $117.9 million per year to continue this initiative and providing per-pupil payments instead of competitive grants. And I'll just insert there that as I work on mental health throughout the state, it's that sustainable, ongoing funding that is just critical. We don't have time to stop and write grants over and over. We need to have sustainable funding that really allows us to put these important services in place. $18 million per year is being proposed to reimburse schools for costs around this expanded list of school mental health professionals, and $580,000 per year for staff training on evidence-based strategies. Additionally, his budget will provide $3.6 million in fiscal year 23-24 and $7.3 million in the following year to allow schools to receive Medicaid reimbursement for telehealth origination costs, also an important aspect of providing mental health services. Our kids can only achieve their full and best potential when they can bring their full and best selves to the classroom. If we want to have a chance at improving our kids' outcomes, then we must shorten the odds.
Well, good morning. It's great to be here, and congratulations to the Sauk Prairie School District for getting this grant. It is a lot of work, as you know, the people who put it together, but it's really important, and it's really a big deal that you've got it in this community. It's rare that I get a chance to see something now in my 11th year of Congress. I'm still working on things I started my first year of Congress, and things are slow to move through federal government. I started out in the county board of supervisors in Dane County, and you can impact a certain number of people, but fairly quickly. Went on to the state legislature, you impact more people, but it happened more slowly. You get to the federal level, and honestly, sloths watch us and wonder why we're moving so slow. It can take a long time to have things happen through the federal government. This, though, issue of mental health is so important to people in both parties, and that's why it was the bipartisan Safer Communities Act that we passed to make sure that we're looking at the aspect of mental health, because it is such a big part of safer communities and law enforcement and so many other issues. I used to be the ranking Democrat on the Corrections Committee in the state legislature. Scott Walker was the chair of the committee at the time. Interesting when you go back and think about those days. And it used to be something like 25-30% of people in prison, and that number may even be greater now, were there really for mental health related reasons. Could you imagine if we incarcerated people who had cancer at that rate simply because they had cancer? And we've evolved on where we've come on mental health, which is great, and we need to, and we've done it in a bipartisan way. So that was an important bill, and through the appropriation process, and I serve on the Appropriations Committee, we were able to make the funds available. This was just passed last May in the House and signed into law in June. By congressional standards, that is like star speed, right? It's moving very fast. And the fact that you were able to get that grant because you put together a really smart proposal that shows that connectivity between all the agencies and how it's going to work is exactly what you said, Jeff. I mean, that's what they're looking for, are models that we can then replicate and that people can benefit from across the state of Wisconsin and across the country. And your model that you proposed is one of the best that they were able to put out there. And that's a really big grant out of the funds that we made available. So I'm just really proud to see the federal government do something that works quickly, because I usually am not allowed to put that in a sentence when I talk about the federal government's work. But the fact that you all did such an amazing job and that this is going to be really, hopefully, that model for other communities in Wisconsin, I'm just really glad to be a part of it. And again, congratulations for all the hard work you did to get here.
We don't know if there are questions from those of you in the audience or those of you with those large cameras, but Congressman Pocan did offer that he would answer a few questions if you had them, either about the federal government's involvement in this, or if you have specific questions about the school district and our plans. We'd be glad to take a few questions. Otherwise, we'll take a few moments to celebrate with each other and feel really good that we're launching this grant together as really a regional team of county, state, and federal partners. Want to join me back up here? Anyone have a question about this grant or about the federal government's involvement in student mental health?
as I mentioned, one of the I think good things that I've seen over now a 30-year career of doing this, we've gone, I think, from the incarceration stage simply for people with mental illness to understanding this and really proactively looking at it. From gun violence to a lot of other issues, this is now getting people's attention at the federal level, and we're doing a whole lot more and doing what we should. This is illness, just like many other things are illness. So it's now getting, I think, that full breadth of attention and finally the financial support it needs to. This is one way for us to look at it through local communities. How can you address it as it's happening, how to try to help prevent it? But absolutely, at all aspects, there's funding from NIH to a lot of other areas trying to address this as illness. And, long overdue, but thankfully it's happening.
I can just briefly add that this is something that was on the rise prior to the COVID pandemic. And it's sometimes easy to associate COVID and mental health as that those are the, if we hadn't had COVID, we wouldn't have these mental health struggles. Well, I do think that the rise we were seeing increased, like it was ramping up during COVID. A lot of these concerns that schools and other agencies had about youth mental health were very prevalent in the years leading up to COVID. I'm glad people are paying attention to it differently after COVID, but it is something that we saw on the rise well over a decade ago, and it's really time that we as a whole community talk about it more openly.
Yeah, how have the students or student groups responded?
The grant is relatively new news, and so we haven't had a lot of work with students on this specific grant, but we are really proud that our students are taking ownership of this issue with us. We launched a Sources of Strength program both at the middle school and the high school this school year. It's a peer-to-peer program that really, as we talk about and Sources of Strength teaches, adults know second or third. It's the peers that know first when one of their classmates is struggling. And this program is helping bring to our students 6th through 12th grade tools so that they can rely on each other and rely on their own internal sources of strength and external sources of strength to get them through moments of pain and mental illness. I'm really proud of how our students have done that. They presented to our school board a few weeks ago and did a phenomenal job. Now they need to continue to bring that message to more and more kids.
I have a question on the timeline for the implementation. I realize it's a 5-year grant, but what are some first steps that the district is going to be taking to start the implementation?
Thanks, Marcia. We're moving really quickly. Fortunately, the federal government allowed us to begin spending money in this school year and not to have to wait till the new fiscal year for our school year, which starts on July 1st. And so our school board last night approved several positions, the cross-agency coordinator, the clinical counselor, and the 2 new social workers, so that we can post those jobs this week and begin to recruit candidates. These are candidates potentially who haven't historically worked in a school. We don't have a licensed clinical therapist on our team. And so we're really glad that the Sauk Prairie Healthcare has already agreed to work with us to support that new colleague and potentially be someone that's shared staff between the healthcare system for this region and the school district. But hopefully those jobs will be posted in the next few weeks and that we can have people in place this summer so that we can do training together and be ready for the return of students in the fall.
You said something in your introductory remarks about over 18% of the population who you were thinking of receiving services. Could you explain what you meant there a little bit? And do you think that percentage of adults and people in the community might grow greater than 18% as this gets moving?
Yeah, I'd be glad to. The program is called Care Solace, and it's either web-based or phone-based service that you can call into saying, I need this sort of help. I'm unable to find it. And they act as a concierge to try to connect you to the right person or agency to get that help. It might be it might be an online therapist, it might be an in-person therapist, and they're able to see the available spots in local providers' calendars that may be due to a cancellation and hopefully get somebody into care faster. We knew this was going to help students because we know that the wait time to get access to mental health care can be 6 months to a year. You know that is true across communities all over the state. So we anticipated that we were going to have families calling in and saying, my 9th grader needs help. I can't find it, help me out. At the 6-month report, what surprised me is that 18% of those who asked for help through the service are between the ages of 18, 65, or 65 plus. And because I don't get the names, I just get like anonymous data chunks, but I also get data chunks on what sort of help were they seeking. Is it substance abuse? Is it anxiety? Is it dealing with trauma? And there's a fair number that are seeking marital counseling. That's not our kids. We know that. And so it was just one of those moments when I opened up the data set, I thought I never expected within 6 months that we'd have community members and parents and grandparents using this school service to get help for themselves. And that's what's happened, which again reinforces that idea of that how can the school district be the service delivery hub? Because we do connect to so many of the families in every community, and then hopefully be the ones that connect them to long-term care that maybe they couldn't find themselves. Thanks for the question, Dave. I appreciate being able to talk a little bit more about that too. We are so lucky that in downtown Sauk City, a brand new bakery has opened over the past few months, and some of their churros and cookies are back on the table with the Sauk Prairie Eagles tablecloth. And so enjoy the treats from a new local business owned by a local family. And again, just I want to thank all of you for being our partners. So many of you in this room are the people with whom we'll be doing this work over the next 5 years. And together figuring out the sustainable model that makes sure that after federal government funding expires, that this program and these services continue to be healthy and supported for our families and the community, and obviously the students that we serve. Thanks for being here. Appreciate your time.
Lying in the cold and the dark, it's true I lost my way. Though I am jaded, I'm wasted, I'm tired, I still beg the state of fate. This tangled mind of mine sees truth in silhouettes. Though the flame that casts the shadow is long since gone to rest. There's roads for no one else. I must do this for myself.